Myeloma is only going to be a chapter in your life, not the whole story. Getting a diagnosis of multiple myeloma and choose to undergo a transplant can be overwhelming at times. Try not to have those feelings and remember your family, friends and caregiver team are here to support you. Now first come to the point who are eligible and who are not eligible to go for a transplant. Patient till age of 75 years can go for a transplant. In addition to age, there are some other factors that can influence your eligibility criteria, which include the staging of your myeloma, overall health situation whether associated with some serious condition, and the treatment that you have already received. The patient over age of 75 years will not be eligible to go for a transplant, and patient who have some serious health conditions such as liver, heart, kidney, diseases associated, they cannot go for a transplant. Now, when should we go for transplant? When all other treatment are not working or the disease has again come once it has been treated. You should consider going for a transplant. Now, what are the requirement you need before you go for a transplant to help assess whether you are a good candidate or not? Your doctor may advise you some tests such as some blood tests, some imaging test, X-ray, CT scan, some heart function test to check your heart function, ECG, to liver function test, lung function test, and HIV hepatitis B screening test. Now coming to the procedure, first we will be collecting the healthy stem cells from your own body. In this process, before going for that, we will be giving growth factor to your body, which will increase the amount of healthy stem cells in your blood, and we'll be placing one intravenous, you can see, which will be separating your blood from your body, and that blood will go through a machine which will separate the blood and the stem cells. These stem cells will be filtered for frozen for transplant, and that blood will be filtered and will go back to your body. Coming to the next step, we'll be giving high dose chemotherapy to you, where the cancerous cells will be killed down, and then if day or after 2 days, we'll be transplanting the healthy stem cells to your body. It will take a few days or few weeks to recover from that after the transplant procedure. In that recovery period, transplant cells will settle down and will develop into new blood cells. Now coming to the, as we all know, every procedure have its pros and cons. First, coming to the cons, you can have some bone pain, hair loss, dizziness, you can have excessive bleeding, you can have some lung issues, shortness of breath, some infections. And coming to the pros of the procedure, a successful transplant may lead to, and can help you lead a cancer-free life or delay the progression of the cancer. As stem cell transplant can be seen as a new journey and an initial journey of your treatment journey, multiple myeloma can only become a chapter in your life, not the whole story. Thank you.